All right. Welcome, everyone, and thank you for joining us today. My name is Nancy Gerges. I'm one of the previous students on the MSc Distance Learning Periodontology program, and I'm going to be your chair for this morning. We hope this session will address any course-specific questions you may have, and will help you gain an insight into what it's like to study on one of our master's programs. I'm delighted to introduce today's speakers, Professor Jacopo Butti and Dr. Imbar Eshkol-Yugev. They will provide an overview of our Perio MSc program, followed by a Q&A session in the second part of the event, so you can ask any questions you may like. This session is being recorded and will be available on our website following today's event. Now, let me introduce our speakers. So we have Jacopo Butti, is a professor of periodontology at the UCL Eastman Dental Institute and honorary consultant in periodontology at the UCLH Eastman Dental Institute, Dental Hospital. He's a clinical specialist in periodontics and a member of the Royal College of Surgeons of Edinburgh. Jacopo is the program director of the MSc in Periodontology Distance Learning at the UCL Eastman Dental Institute. Also, we have Dr. Imbar Eshkol-Yugev, clinical lecturer in periodontology and deputy program director of the MSc in Periodontology at UCL Eastman Dental Institute. Dr. Eshkol-Yugev is actively involved in teaching postgraduate programs, including both MSc and MClin Dent in periodontology. She also oversees clinical training and supervises a diverse range of research projects. So welcome to you both, and over to you, Jacopo.
Good morning. Thank you very much, Nancy, for your introduction, and welcome everyone to this session. We will go through a series of slides, so I'll try to give you a flavor of the MSc Distance Learning program, and then we will have some time at the end for to answer any questions you might have. So this program started in 2019, so it's a relatively young program, and the team, the main actors that you will see if you join this program is myself, Imbar, connected today, and our program administrator, Marianne Norfolk. She might be joining at some point this session to say hello to you guys. And so this we have of course this is program is one of the programs that we offer at the Eastman Dental Institute in periodontology. So we have currently the full-time program as well, the MClin Dent in periodontology, and the MSc in dental hygiene. So it's a large unit. So we have, there are other members of staff that participate in different form to this program, to the teaching and the supervision of projects in relation to this program. So the structure, let's start from the format. So this is really more than distance learning, it's a blended learning type of teaching. So it's organized over 3 years with different exit points. So we have a certificate here, a diploma, and an MSc. So there is a possibility to complete 1, 2, or 3 years of the program. It's blended learning because the majority of the teaching happen virtually online, either with sort of a synchronous session or pre-recorded lecture and a large volume of available teaching content in the form of the reading list, in the form of task assessment that happen or during the course. So 3 years blended, and then there is a blended because there is also a component of face-to-face teaching, which is organized into residential weeks that happen over the 3 years. And currently we have 2 residential weeks during the year 1 of the training, 1 residential week over year 2, and 1 residential week over the year 3. So now we'll look into more in details how they are structured. So overall, we have 8 modules that are required to be completed in order to get to the MSc for 180 credits. So in terms of the year 1, so the certificate year, this is organized into 3 modules: scientific basis of periodontology, periodontal diagnosis and treatment planning, and non-surgical periodontal therapy. And we have, as we said, 2 residential week. Normally they happen in October, mid-end October, and the second one around February time. Diploma year, so this is organizing 4 modules. These are quite packed and intense here. So we have the first part of the year that covers aspect of complicating factors and other oral conditions. Again, we look more into what that means in terms of content. We have a module which is more research based, methodology of research is discussed together with sort of some application into study design. This is the evidence-based healthcare module. And then we have 2 modules that are more into the sort of surgical aspect of periodontology. This is the surgical periodontal therapy, and the module which is an introductory module for implant therapy that covers the fundamental aspect of diagnosis and management of particularly non-surgical management with some aspect of surgical management of implants, dental implants. For this module, we have a residential weeks normally happen in March. And then there is the dissertation year. So the last year is got a different sort of structure compared to the year 1 and 2, and we'll see that later on in the presentation. The dissertation year is more sort of independent sort of learning, and although there is a number of activity that are closely sort of monitored in terms of submission and in terms of preparation of the dissertation. And this is involved the preparation of the research projects that can be sort of, depending on the project, can be different, but mostly so far we have organized the year into having sort of active involvement in clinical research based on the individual practice of the students. So we'll discuss a little bit more about that, but it's a model of research where incorporates some sort of real life research in clinical practice. And there are 2, so there is 1 residential week over the year 3, which is normally split into 2, so 2-3 days in September and 2-3 days in February, in order to sort of deliver teaching tailored at a different time of preparation of the dissertation. So in general, the program involves as we said, we have a number of modules, and each module is organized into weeks in terms of each week of the academic sort of calendar year is normally dedicated to a specific topic. So within that week, again, we'll see some example, you will find the content, the material, and if relevant, some assessment that belong to the specific topic. So is a progression that is, so the way in which we have structured this program is not by releasing all the content in one go, like you might find in some other online program where you find sort of the overall module contents open from the beginning, but here we release progressively the teaching content with the idea of making sure that each step is building up on the next step. And because I think one of the challenges you may face with online learning is that if you don't have a clear structure, a clear progression, I think it might be quite easy to sort of lose the track, lose the flow of the learning. So within that, say that again, we have a variety of online activities that are again tailored to the type of topic. So the main site where you can find you'll find all the content is Moodle. Moodle is a virtual the virtual learning environment that we use at UCL. And essentially, for each year, there is a dedicated Moodle page, so a dedicated virtual environment where all the relevant information is found, and is the way also where we can communicate with the students. So, for example, here I'll give you an example of what is Moodle look like. So, as I said, each week, let's say, of the academic calendar, on the Monday we open a specific week, so a specific topic, and where you will find an initial sort of presentation of the learning outcomes and objectives for the topic. You see here an example of the topic of periodontal wound healing. This is a topic that belongs to the module of scientific basis of periodontology. And within that week, you will find then the learning material. So you will find a reading list. Here, that means that you have a selected list of scientific paper or a reference to specific book chapter where you can essentially study and prepare yourself. This is, of course, a careful selection of what we feel are the most relevant evidence and paper that need to be covered as part of the topic. Together with that, you can find some pre-recorded lecture from different different speaker, external, sometimes have pre-recorded material for us. And then the other element you can find is a section which is called formative assessment. So during the year, there are a number of formative assessment. For those of you who don't know what does that mean, what's the meaning of that, is that a formative assessment is the assessment that does not count as towards the final module mark, but is done in preparation to the actual exam. So we have a series of this assessment. They change depending on the week. Some are simple quizzes, other are more articulated type of task. For example, recording a video, preparing a presentation, or preparing an essay, or indeed answering some clinical question on clinical cases that are given in that week. So there is an element of building the knowledge on clinical case preparation and presentation as the program progresses. So this is an example of the reading list. So all these papers are freely accessible through the library at UCL. So these are links that direct you to the PDF of the paper. And also you see at the top of the list our reference book, that is the Jan Lindy. And that, again, this is the sort of a companion that you know, a reference point for all the students that learn and study periodontology. Beyond that, of course, we have, you know, there is a lot of resources. There are a lot of resources on Moodle. There is a clinical forum. The clinical forum is a space where students can post clinical queries. And there can be a discussion with other students and, of course, with the staff member related to specific aspect of perhaps clinical management of patients in practice, and so on. So alongside the sort of preparing and learning the material that is presented is ready, available on Moodle, we ask and we want our students to keep a logbook, a clinical logbook of their clinical case that are done in practice. So essentially, the model of learning is that there is the virtual environment, which is Moodle. there are a number of sessions that are pre-recorded, a number of sessions that are done in a synchronous way as well. So we have online teaching, and then the rest of the learning is also embedded in the activity that everyone does in the clinical practice. That's why it's important, if you're aiming to join the program, to make sure that you have the capacity, or at least you will have the capacity at the time of joining the program, to access a cohort of patients with periodontal needs and be able to follow them, because there is an element, of course, of applying the learning into clinical practice on a day-by-day basis. And as part of that, again, we ask to collect this information in an online clinical logbook, which you can see here is an anonymized, in an anonymized way, that you can record all the clinical activity that is done on patients. So that you see some screenshot here, for example, the recording the medical history of the patient, recording the type of treatment or you have been providing, reflecting on the cases, making sure that you have follow-ups on these cases, and so on. So this is again part of the sort of expected task, that need to be done as part of the program. So the certificate here, we said about the structure. Let's talk about what are we covering there in terms of content. So the year one essentially is aimed at give the fundamental knowledge, scientific knowledge of periodontology. This is covering the scientific base of periodontology. So this is more a sort of theoretical module where we discuss about, for example, anatomy, etiology of periodontal disease, pathogenesis. We cover microbiological aspect of healing, wound healing aspect. So all this, sort of the requisite to understand periodontology and periodontal disease. The other two modules, which are periodontal diagnosis and treatment planning and non-surgical periodontal therapy, are in a way more sort of clinical, so have an element of theoretical knowledge, but also an element of clinical application. So the periodontal, so between these different modules, we cover some fundamental aspects in the management of periodontal patients. So one of these, of course, is how to assess a periodontal case clinically. So we offer sort of learning and training on different aspects of clinical assessment that include appreciation of the soft and hard tissue, how to describe also a clinical case. So there's an element of how to present clinical cases. There is specific training on radiology specific to periodontology. So how to report radiographs, how to describe, how to identify pattern of bone loss, intrabony defect, furcation, so to be confident in presenting and reporting X-rays in relation generally, but again, with a more focus on periodontal aspect. We do provide training on photography, so dental photography. Again, case documentation is really crucial. Is absolutely essential tool and skill that need to be gained as part of appreciating also the outcomes of treatment, the change between different phases of periodontal therapy. So there is that documentation of a case. So as part of we said of presentation of cases, we give some sort of general guidelines and templates on how to build a clinical case. That include again putting together photograph, X-ray, charting. Yeah, so there is an element of preparing a full case documentation. Here, I just want to give you an example of some of the short video we just quickly go through, where we sort of provide, for example, some teaching on how to record a periodontal assessment, specifically a periodontal chart. So I'm just gonna go through the video.
Good morning, Mr. Shah. How are you doing?
Yeah, I'm really good, thank you.
Good. My name's Dr. Mehta, and I'm the periodontist here. I'm going to be doing an assessment of your teeth and your gums today. This is Victoria. She's going to be nursing with us as well.
Hi.
Okay, so I believe your dentist has referred you with regards to some concerns about your gums. I'm going to go through some questions with you first, to hear things from your point of view, and then I'm going to pop you back in the chair and do a clinical examination. If we need to take some x-rays, we'll do those then, and then I'll go through everything with you afterwards. Is that okay?
Yeah, that's great.
Perfect. So from your point of view, do you have any concerns regarding your teeth or your gums?
Yeah, I do feel that my gums are bleeding, and I do have some teeth that are moving a little bit as well, and I'm really afraid that I might be losing them. And I also have receding gums.
Okay. And do you experience any difficulty in chewing, or do you get a lot of food stuck in between your teeth?
So I'll go through.
Bleeding, we have all sites on the upper right, 8. On the 7, medial distal. 6, all sites. 3, distal. 2, distal. And 1, mesial.
Okay, so this was just to give you sort of flavor of what is what you can find sometime on Moodle page. So of course this is a pre-recorded video that is accessible, and then when it comes to the residential weeks, we will go through a series of activity done on models or working on each other, where we can practice also in terms of again, important how to organize, for example, you know, your sequence of assessments from the collecting medical history, as you have seen here, going to the recording a periodontal charting, which in parameters are essential to record, which targets are expected as outcomes of treatment, and so on. So all these are aspects that we cover. Other example of sort of short clips that you can find is about instrumentation for clinical assessment. Again, I'll run this in this case, for example, you see a short clip of describing the shape of the UNC15 periodontal probe used for periodontal assessment. Again, you can find sort of demonstration of probing technique. Again, this is a sort of complementary sort of material to then practical exercise that are done during the lab week. So this is, again, there are different video, for example, on probing. Then there are different videos on, for example, instrumentation as part of the non-surgical periodontal treatment. There is clearly a focus on diagnosis, so how to diagnose periodontal disease, and then the use of the classification introduced in 2017-18, where again we will discuss all aspects of the international sort of EFP, AAP classification, but also application from the British Society of Periodontology. For example, the use of tools like this, which you probably are familiar with, in terms of application of flowchart for the management of a periodontal patient. This is, of course, discussed. There is a focus on discussing element of prognosis, specific in relation to, again, periodontal aspect. So this is an example of a task that you'll find as part of the week where we discuss periodontal prognosis. And you see here a brief outline of a photograph, an X-ray, and a screenshot of a section of a periodontal chart. And after discussing prognosis, there is a task given to sort of try to allocate and assign the correct prognosis, for example, to these two teeth, the lower left 6 and lower left 7. And then there is an element, of course, of discussing, providing feedback about this exercise, and this can happen by means of sort of written feedback or on a specific sort of relevant topic. We organize synchronous online session where we discuss, for example, prognosis, and we try to iron out doubts in relation to that. Again, this is another clip that show you, again, when we discuss about instrumentation. So we cover the most relevant instrument for non-surgical therapy in the year 1. So the use of universal curette, Gracie curette, sickle scaler, ultrasonics. And again, we have this video that are complementary. For example, here we show the how to use a 1314 Gracie curette to instrument the distal surface of a lower molar. And then during the residential week, we provide training. And of course, there are some elements also of exams and assessments in relation to this type of activity. And you see, this is one of the typical model that we use, where there is a simulation of soft tissues and defect. So defect as a result of periodontal disease or periodontal condition in general. Okay, so this is another example. I was talking about case presentation. So case presentation, you can see in these slides a screenshot of different slides that are part of the clinical case presentation template that we use. We provide that, and then you can see here an example of how to build a clinical case with the clinical presentation, with the radiographic image, with the periodontal charting, with a slide on that discuss about prognosis, et cetera, et cetera. So this is also a skill that is very, as we said, very relevant, and this is part of the training of the year 1. This is some, again, photos taken during activity that we do in the residential week. Again, most of the activity is lab-based. However, we have on key topics, we have session like when we discuss in terms in the form of literature seminar or case presentation or you know, evidence-based case presentation, where we sort of also the student are asked to present either the clinical case or maybe some papers, or summarize some of the key evidence that we have covered as part of the program. Some screenshot here, again, photos from the residential week. What you can see here, so during the residential week, as I said, there is some activity in the lab where we have, you know, a large amount of phantom head models where we can work, but also there are some activity that is based on working on each other. So you see see our students were engaging in different type of activity. On the left, you have a periodontal charting, so an assessment. In the middle, some sort of instrumentation. On the right, you see a clinical photographs taken. So all these are, again, activity that happened during the residential week. And in the background, you see the clinical suites. So on the when you come to the residential week, you will the Eastman Dental Institute is based in central London. So, and we have on the Rockefeller building, and then within this building we have a different areas, where one is again for lab-based teaching, and this is one where we have 8 dental chair where we provide the training when it comes to working on each other. These are the labs. Yeah, I was saying about the labs. These are well equipped labs. So you have phantom head. Each station is on screen. So the typical model of teaching is some of the tutors provide an initial demonstration of the exercise, depending on what it is. For example, these are activity related to the year 1. So you can see the kits, that sort of Gracie Curette that are provided. And then there is the element of exercise with the tutor working around, providing support and feedback on the application of this. So the year one, we said about the year one. So what is the overall journey of the year one? We start from the baseline assessment. We learn how to assess a patient with periodontal needs. We learn the fundamental knowledge of periodontology. We learn about diagnosis, treatment planning, and we learn about providing non-surgical periodontal therapy to our patients until the reevaluation and consideration for the next step of treatment. So as part of the year one, so as part of beyond, of course, all this activity, eventually each student is asked to prepare clinical cases and then to present these clinical cases at the exams. So to submit and present these clinical cases, which are, again, covering all aspects from the diagnosis, prognosis, initial treatment planning, and reevaluation of the case. Once the year one is completed and moving to the year two, there is clearly a further steps in terms of learning. And here, there are, as I said, there are different modules that cover quite different things. So the first that you see in this list, the complicating factors and other oral condition, is essentially a module that provides knowledge on the management of a periodontal case with a complicating component. What does that mean? It means that we is a case that is beyond the sort of the more conventional periodontal case, by a case that may have a complicated medical history, complicated risk factor, might have other components of, I don't know, making the management more complex. For example, overgrowth of soft tissues, or aspect of oral medicine, oral disease that may interact, interfere, or affect the periodontal management. So in this module, we cover all that. We cover also aspect of clinical governance. This is very relevant. Audit, how to run audit in clinical practice. And again, as part of this model, it is expected to submit a clinical case demonstrating competencies of management patient with a complicating factor. The evidence-based healthcare, as I said, is more about methodology of research. So here we cover, for example, how to critically appraise a scientific paper, some key aspect of study designs, how to define the research question, how to define how to choose a study design based on the research questions, how to again what is the impact of different study design on conducting research, what are the biases that affect a research project. So this is again there are aspects of statistical element. This module is designed in the year two to get some basic knowledge in preparation to the year three. So is designed to help then the next step, which will be the dissertation. And then we have as I said, the surgical therapy module. So again, I go through some photos with you. This is so when the program initially started, we have very sort of good plan and ideas what to do. But then we have the pandemic that changed completely the perspective. So this is when we over that time, 2020, 2019, 2020, we couldn't have students over to the Eastman, so we had to prepare sort of what we call periodontal training kits, and these were shipped over to students everywhere. And then we ran our training, so we didn't stop. We ran our training through sort of online by sending again surgical kits, surgical models, and with the students ordering pictures in their respective country, and then we did some sort of virtual training. Of course, it was a very challenging time. We hope we don't have to do this anymore. This is some of the setup again of this is myself recording some of the video that you have seen. Again, these are an example of what you can find when you come over for the residential week of the year 2. So the residential week of the year 2 is a very packed week where we discuss, essentially we cover all the most important surgical techniques in periodontology. So there is quite a lot of online content before the weeks where we discuss about scientific aspect, we discuss about, you know, understanding different aspects of surgical therapy. So open flap debridement, regenerative, mucogingival, crown lengthening, management of teeth with furcation involvement, and so on. So once this sort of knowledge is covered, then during the residential week, we go through step by step some of the most important surgical technique. And again, the format is typically, like I was discussing before, a tutor providing a demonstration of the technique, and then the technique is applied on by the students. Okay, so again, this is some of the kit used, the surgical kit that we provide. Again, a short clip to give you an idea of the type of activity that we do. This is taken during one of the residential week. What about the 6?
Around the 6, I think it's like around 9-10 millimeters distal. Yeah. The pocket.
Okay, so what design would you do?
Maintain the paramarginal as well.
Maintain the paramarginal. So tell me what, if I'm doing a paramarginal here, then what do I do at this point? Carry on?
Carry on, and then maybe stop a little bit before.
Okay, so I'll stop here. Okay, so if I do my incision.
Yeah. Stop there. Yeah.
Stop there. Okay. Right. So this is again, you could hear myself and then interacting with the students and discussing about a planning for a surgical incision on a model simulating periodontal disease. These are other image. You see, these are models that we use, for example, simulating the presence of calculus, simulating the presence of recession, simulating the presence of pockets and bony defect. And then again, these are aspects, photos taken during a planning stage of a surgical procedure. In this case, for example, planning a root coverage procedure, and so the orientation of the specific incision. And again, you see here image where we discuss about, you know, the incision. We discuss about how to perform a different type of flaps in terms of partial thickness, full thickness, and so on. These are all aspects related to the therapy. Here we are showing how to thin, for example, a surgical papilla, or how to perform a specific type of suture depending on the specific type of technique. Another clip, again, just to give you a flavor of what one of the exercises that we do. You see this is during the residential week on a pig jaws model, and we were discussing about suturing technique. We said we have done the horizontal external. The same, with the same concept, we could do an horizontal internal. So basically, instead of coming out on the same flap like we have done before, we enter. And then, because it's internal, if you remember, in this case, we go inside again. So we go on the other flap. Okay, so this is the first part. Then we come back But this time, because it's horizontal, we can remove either more distally or more mesially, in this case more distally. We go in. Okay. Okay, now as you see, like I've done before, if you remember for the vertical internal, I've left a loop here. Yeah, so we are in the same situation now where, again, I'll go backly. We are in the same situation now where we can do a horizontal internal with or without the loop. So if I pull now the suture, yeah, if you can see the internal bits, yeah? All internal, the suture, horizontal because in horizontal plane. And you can do with or... Okay, this is just again, give a flavor where we discuss about a horizontal internal matrix suture with or without a modification. And again, we do this one by one, this exercise. You can see multiple suture done on, in this case. First, we do it on a straight line, and then we apply on specific surgical technique around teeth. Again, you see here other example. So probably just skip. This is here. You see other screenshot, other photos taken by the flap elevation. So we discussed about vertical raising incision. We discussed about partial thickness, full thickness. For example, you see on the picture on the right, the different layer of soft tissues within the flap. And we practice, of course, all these aspects. We discussed about mucogingival. For example, here you see a training, an example of a training of harvesting soft tissue graft from the palate, and you also see outside the graft taken outside the mouth, and the management of the graft, the adaptation, the desepithelialization, depending on it. So we cover all this that as part of the mucogingival element. So here you see another clip of a video discussing aspect of mucogingival surgery. Again, I'll play this so you can have a bit of a flavor of that.
Did everybody understand that? Or anybody still have questions? Because that's a very important concept and it's actually key in terms of the stability and the healing and the aesthetic outcome. So if anybody didn't have it very clear, we can repeat it again.
Can you repeat it, Eva?
So what Roberto was saying is about the design of the trapezoid, yeah, of the flap for your single incision. So you can either do, as he described, a triangular. So your vertical incisions will end into a triangle, into a very thin line. The other option is going to be when you have like a more trapezoidal. And the differences between the two are going to be where you adapt your papilla at the end of it. Let me see if I can do a small drawing of this, and that may be a bit more clarified.
Thank you.
No problem.
Okay, again, here you see on a pictures model, a recorded video describing a coronal advanced flap. So we talk about, how to perform an incision, what's the difference between full and partial thickness, how to design a surgical papilla, how to adapt the flap, to release the flap, suture, and so on. In some occasion we had especially when we had some days during COVID, but where we can have live surgery happening. So you see here an application. So you've seen the journey from the application on models, then on pictures, then with sort of short video, and this is another example where we did a one of our external contributor and teacher, Professor Rotundo, shows a procedure which involves a corner advance flap for root coverage of a lower incisor. So again, I'll play a little bit this. Oops. So again, you can see this during the live surgery, there was the opportunity, of course, to ask questions. And in this case, there is a desepitalization of the surgical papilla after having created a corneal advanced flap. So you see the different, as I said, the different elements of learning and application of the technique, again, in this case for mucogingival. Okay, so I'll stop here. I hope you had the sort of understanding of what kind of different type of teaching we have. Of course, there is also a social element. It's always every year is different, but most of the time we have a very good bonding with for the students, with them, as a group, but also with us. So we have opportunity also for social event. We are part of a large unit, so apart from some sort of occasion when we can have social event as part of the MSc, there are, of course, opportunity for attending conferences, or event organized by the Eastman. So this is again some sort of a screenshot of a post taken from one of our ER group at the end of one of the residential week. This is actually during COVID, so where we ran all the week online. So at the end, it worked out well anyway. A little bit about the location. So as I said, the Eastman Dental Institute is really in a central position in London. I think to give you an idea, for those who know, London is very close to the main UCLH hospital, so Euston, near Euston Station. The Eastman is currently, so since we moved, because before the Eastman was in a different location in Gray's Inn Road, not far from the actual, but it was combined, and the university was and the hospital were in the same sort of building site. Now is separate, so we have the university, which is in Rockefeller building in 21st University Street in London. And then around the corner, there is a new hospital, was built in 2000, was open in 2020, if I'm not wrong, or around that year. And again, is a new hospital, but most of the activity, all of the activity of the distance learning program will be at the online and at the Rockefeller building, where you have seen the labs and you have seen the clinical suite. What else do I have to show you? This one here, I think, is just a rendering of the clinical skills laboratories and the planning. This was done, of course, a few years ago before we have seen the real picture. This was the actual rendering before the opening of the labs in 2020. As you can see, these are all new, and then there is a large space with a large number of phantom heads equipped with monitor and screen. So it's a very good environment for teaching and learning. Yeah, so as part of that, this area we run also other CPD courses and overseas registration examination. Okay, so this is again, so to have an idea of where we are. And then, and this is another video. This is a promotional video, but I'll show you so it can give you again a flavor of the environment, especially of the clinical suites where you've seen. I was explaining where we do the activity and the clinical element of the activity working on each other. So I'll play this. So this is me. And these are some of our students now in the last year of the training, but here they were doing some sort of exercise as part of the residential weeks of the year one. Okay, so again, here we have demonstration of curette positioning and discussion about, how to optimize, how to select curette, how to identify the cutting edge, how to correctly position a patient. Again, these are, you see, this is the environment, is the second floor of the Rockefeller building when we have all the 8 dental chair, and we have a dedicated research and education team that look after us, and we are very grateful because they, constantly support our teaching and activity and research activity across the institute and the hospital. Again, this we have screens so we can sort of follow the activity that happen from different positions, also to assist with feedback to the students. You can see here Imbar helping again, supervising, checking instrumentation technique of one of our year one student at the time. Again, demonstration of different aspect of periodontal management, OHI, plaque disclosing, polishing, ultrasonic. This is me in the clinical labs. I show you before some screenshot, and then again this is some of the training done during the residential week. You see the pictures. So here we were discussing about flap design, as you can see from some of these slides, and the use of you had these these slides and with step-by-step description of the technique before the actual exercise. We mostly record all these sessions, so there is also an opportunity to go back and review the content, or we have, as you have seen, some clips that grasp the most important aspect of that. And again, this is like through the iPad that was using for recording some of the video. And as you can see, while I was demonstrating the aspect of the technique, then you could almost simultaneously try to repeat. This is a step of the flap elevation conducted on the buccal aspect of a pig jaws. And again, this is sort of some Imbar providing some feedback on the flap elevation. Then here we're talking about suturing technique, as we have said, and so on. Okay, so this is just again to give you an idea. As I said, we have social event often. This is me being late on the table, so I think they sent me a picture to try to hurry up. I was probably running late from some of my clinical activity. So that's also, and this is some picture which every year I should update really, of the different cohort of students over the years. 2019, you see a picture of the old Eastman, and the fountain was a beautiful place. Bit old, but very nice, old in terms of equipment, but very, very nice environment. But again, now we have, of course, very nice facility anyway. And then you see some of the picture of our graduation and other sort of social events we had over the years. This is another a bit outdated picture, and it's I mean, probably need to some of these staff member has changed or left, but most of still here. As you can see, there is I put here sort of a list of names, just because there is a number of academic staff helping us, and then of course there is the hospital side that at times also provides some sort of teaching and support for us. And again, this is some photos of conferences or events that over the year, there's some conference in Spain or over events at the Royal Air Force Place Club in London, where we've done some sort of celebrations in different year and different type of programs here, mixed together. And this again in the old Eastman. We have an Instagram page. Probably we are not very good in updating that often, but this is the sort of QR code you can scan, and then if you want to follow us, you can see also some of the initiative that we have over the year. And yeah, so I think this is the main thing. Just a couple of final comment I want to make. Just to make it clear for everyone. So the MSc Periodontology Distance Learning. So we have two main program running now in terms of periodontology. There is the full-time program, the EMCLIN-DENT, and the distance learning program, which is the one you have just seen. The distance learning in terms of training level, this is what is considered a level 2. So that means it doesn't provide the competencies at a specialist level, but at what we can be defining dentist with a specialist interest. So somewhere in between the general dentist and the specialist in periodontology. The main reason for that is because, of course, it's a blended learning program. So there is an element where this sort of distance supervision of activity rather than direct supervision of patient. So in terms of content, there's no much difference between what we teach at the EMCLIN-DENT and what we teach at the MSc. But as I said, the level that is at the completion of the program is sitting between the specialist and the general dentist. And again, this is crucial as part of sort of making the most of this program, that there is a combination of the distance learning element that we provide, the teaching, but also looking after patient in clinical practice. So who joined the program is expected to see regularly patient with periodontal needs, so has to be a qualified dentist, okay? And we expect generally a couple of years of experience before joining this program. So as such, there is no direct patient care supervised by us in the program. I think I have pretty much covered everything, but I just want to ask Imbar, who's with me, if there is anything else that I might have missed, and she wants to add indeed to this discussion.
Thank you, Jacopo. No, I think you covered everything. You showed most of the things that we teach. I think that the main thing here is that this program is really flexible and allows someone that is a busy practitioner, a busy dentist that cannot commit to the full-time program. I think a very good opportunity to enhance his skills. And if you're interested in perio, I think that's a really a good combination. We also, not sure if you've mentioned that we have relatively small cohorts, so really give a lot of one-on-one feedback and in terms of clinical work. And during our residential week, we cover all the techniques and yeah, you mentioned the comprehensive curriculum that you have. Also, if you're interested in research, we cover also aspects of research. So I think this program really diverse. You can really take it to different places if you want to advance your career. Yeah.
Yeah, thank you. I think it's a good point to remind them. I think the flexibility is one of the key aspects. I think in the choice, often, I've asked, between MCleanDent and blended learning. I'm heavily involved in both. Of course, the MCleanDent is provide you with more sort of direct clinical supervision, but of course is a big commitment in terms of time, in terms of finance, in terms of several aspects, but give you that level of specialist training. The blended learning is offer a lot of other advantage compared, for example, the full-time program. So it's flexible. You can continue working in your practice. In fact, you have to continue working in your practice. Give you the possibility of organize your agenda more or less as you wish. We have a number of scheduled events that normally are planned in advance at the beginning of the academic year. So we have all these sessions that are online. So you can block your agenda for this session, and in any case, they are recorded. So there is the element of flexibility there. So it allows to continue sort of with your life, but gaining extra competencies. And then, perhaps giving you opportunity to diversify your practice and focusing more on perio. So I think that's an added element. So the other, I would say, interesting, as I was mentioning at the beginning, we have now running a few years, we are running this sort of research project where we have effectively real research happening in the practice. So we run multi-center type of model where each practice act as a clinical center, and with real data collection, so we can have an understanding of original research and its application in the year 3. With that, I think I would like also to perhaps involve Nancy, if you want to add any comment on, of course, her own experience as an alumni on that. I think, Nancy.
Thank you, Jacopo. Yes, I'm a living example of surviving this course and still loving perio, surprisingly. Yes, well, everything you covered everything in detail, but I think the key aspects for me were that I continued to work while learning, because it's difficult to take time out of work to study full time for the MCleanDent. So for me, it was earn and learn at the same time. Also, a key thing was the 3 exit points. So the fact that you can exit after the first year and still have a certificate, or after second year and still have a diploma, that was also something very positive for me. I carried on and I pulled through the MSc, so I'm glad I did that. And also a big positive for me was the clinical support I had. So whenever I was learning something, applying it, but then come across a difficult case, or I want to discuss planning a case, especially surgeries, everyone was always on hand to help. I always bombarded Jacopo and Imbar with loads of emails about my patients, and they helped as much as they can, obviously being distant advice, but was very helpful. Anything that I found challenging, I found the support. Also, it's perfect if you want to focus on perio. So if you're a general dentist now, and you feel like you're fed up of general dentistry, or it's not what you like or where your passion is, then definitely this program prepares you to be, like Jacopo said, special interest in perio. So currently my work is focused on perio only. I work in 6 different practices gives me the diversity of working with different groups, different dynamics, and it just keeps it interesting all the time, because not every perio case is the same. That's what I've learned. But yeah, it was all very positive. Of course, there are challenging times. Sometimes the workload is too much, you get stressed, but the tutors are very supportive. And yeah, it was a lovely program. And I think we need to go to Q&A now if anyone has got questions. And I think we had one question from before about the submission of clinical cases at the end of year one. So how many clinical cases are expected to be submitted?
Yeah, thank you. So the year one we have in terms of alongside the clinical logbook. Let's start from there. So the clinical logbook is really not a big task in terms of commitment. So we expect for the clinical logbook to record visits rather than patient. Yeah, number of visits. So a visit could be a baseline assessment, could be a delivery of OHI coaching, can be a session of root surface debridement. And we expect 100 entries, so no cases, 100 entries across the year. In terms of actual cases, so completed cases, we need 3 cases in the year one. One case is for periodontal diagnosis and treatment planning module. So that case essentially involves only a baseline assessment, so collecting clinical photos, X-ray, an initial chart of a patient with an initial treatment plan. That's one case as part of the exam that is done earlier on in February. And then in June, students have to submit other 2 cases. And these are cases that, again, include also a non-surgical treatment element and a reevaluation. So in total, for the year one, there are 3 clinical cases to submit.
Okay, thank you for that. If anyone has any further questions, if you can just drop them in the Q&A box and we'll be happy to answer any questions you have.
Or indeed any comments or anything that is unclear about this, or you want to find out more.
Just to mention, if you're interested in our program, that we also have an Instagram page that you can follow. I can put the link in the chat.
Yeah, I think I put the QR code, but yes, if you put the link in the chat as well, that's of course helpful.
Any other questions, anyone?
A question from anyone? Okay, if not, I think we can probably conclude the session. The last thing I can say again, if there is any question or things that come after this session, you please feel free to email me or email the our channel sort of email address. I can probably put in the chat if
So we have a question actually.
Okay, yeah.
If one needs to take a break from the course and return at later stage, is this possible?
So the program itself is not a flexible program as such. However, there are instances where there are a few examples where we have students that interrupted the course and started again. So typically, if for one interruption of study, let's say I've completed the year one and I need 1 year of break before I start the year two, typically that is not a problem as long as there are some sort of clear reason, rationale, justification for that. Typically 1 year interruption is okay. More than that is very unlikely because the nature of the program is not flexible and it will be really, really difficult to have, multiple interaction in terms of achieving then the competencies in terms of the time as well. So yeah, so you could take, a break for once typically, but then more than that, no.
makes sense. Thank you, Jacopo. Any other questions?
Okay, I'm putting my email address anyway in the chat. If there are any questions, again, I'm happy. I can direct otherwise for more like admin related. There is, again, for application, there is the, you know, directly on the Eastman Dental Institute online page, there is the page where you can apply. And again, if you have any question, you can also email me and we can iron out that. Okay.
Thank you, everyone, for joining us today. And I guess thank you, Jacopo and Imba, and enjoy the rest of your day.
Yeah, thank you, Nancy, thank you, Imba, and thank you everyone for joining this session. And again, hope it's been informative. Enjoy the rest of your day.
Thank you. Bye, everyone.
Bye-bye.